that's their thing. Okay.
Yeah.
All right. So, Dr. White, tell me a little bit about what made you decide to come and open up a veterinary hospital.
So what made me come and open up a veterinary hospital is, golly, you have to give me time for these questions. It's not a good answer. Because I opened a veterinary hospital because there was no retirement plan in being an associate veterinarian for anybody else. And that truly was my driving factor.
Mm-hmm.
Once I started with it, then it became more of a way to practice medicine the way I want to practice
Mm-hmm.
medicine, and not have to rely on what my owners or my bosses
Mm-hmm.
wanted to do
Mm-hmm.
at the practice. So it became more of that, but truly
Mm-hmm.
that was the reason that I opened the practice myself.
So obviously you have a very definite philosophy about how you practice medicine and handle animals in this hospital. So tell me a little bit about what that is.
Sure. That is that we want to do, of course, the best medicine that we can do for them. That is one driving factor of this practice, is to provide quality of medicine, to take care of these pets how, in my opinion, they deserve to be taken care of, and how I feel like, money aside,
Mm-hmm.
everybody would want their pets to be taken
Mm-hmm.
care of and helped. My driving factor in this business, in the profession, is to help these helpless animals. They are completely reliant on us for their help, and that's what got me into this profession.
Mm-hmm.
So given that best medicine, but then also a big driving factor of mine is to handle them with respect and to handle them with low stress and low fear.
Mm-hmm.
The things that we do in this business are scary and fearful, and to try to see if we can make a way that they aren't so scary.
Mm-hmm.
And the pets are not so afraid to come and see us. We got into this business because we love animals, and with that we want animals to love us. And unfortunately, this is probably one of the places that they like the least. So we're going to try to make it
Mm-hmm.
not so.
Yeah. Now, I know that you have an interest in behavior,
Yep.
and that Jennifer does too, your lead technician and your office manager. So tell me about how your interest in behavior kind of started, and how you think it helps you with your practice philosophy.
So that is, that probably actually even goes way back to when I was a child. And one of the reasons why I got into this business is I spent a lot of time as a child trying to figure out why my dog did what it did and what it thought. That truly was a lot of my childhood, was trying to figure out what my dog thought. What did she think all day long when she laid on the couch? And stuff. So, their thought process is a big thing for me, and I think all of their behaviors probably all come from that. And probably my interest is a whole lot more heavy on preventive medicine in that aspect, in the behavior aspect. Can we again make things easier on these pets so that they never do develop the behavior problems that we see so commonly? Is that preventable if we start them out right, if we give the owners the building blocks to help them and understand the dogs, because I think that's a big part of it, that we treat them like humans, and they're not humans. So, with that said, I hope to give the pet and the owner a better life if we can prevent them from having those problems. Is number one reason why people get rid of their pets. In my practice belief, though, with that, what I have found in my belief was that if we again can create a positive environment here and a less fearful environment here in the practice, we have fewer behavior problems here in the practice, and that in essence allows our job to be easier, because they like us and they aren't afraid of what we're going to do to them and with them. So it makes our day-to-day job less stressful for us, because we're not worried about how bad they're going to react, and less stressful for them.
Now, one of the things that I've noticed over the years is that dogs hate to get their nails trimmed, and they don't seem to mind it coming here. So how do you start them out as puppies and sort of teach them that that's okay?
My big teaching it's okay is all food related. Treat and food related, and just that food never makes anything worse, and it can only make things better. And if nothing else, it truly just allows them to understand that even if I don't like what's happening, I get a wonderful food reward when I get done or during it. So the puppies and everything here, and as we teach owners, is it's have something that they can eat. Peanut butter, the Kong stuffing, be giving them a reward while you're doing it. I also think, especially with the puppies, the big thing they're objecting to is the restraint.
Mm-hmm.
It's the holding my leg still, and why are you holding me still? And with the distraction with something to eat like that, you don't have to hold them still.
Mm-hmm.
And that's one of the things we do here is there's minimal holding still. We let them dance around and move around on the table or on the floor, and we barely hold the paw. If we can cut them without holding the paw, we don't touch the paw.
Mm-hmm.
We just get in there and cut them. So
Mm-hmm.
those two things together, I think, work well for them.
Yeah, excellent. Well, I've noticed also that you do a lot of work on the floor.
Yep.
And can you tell me why? I mean, when
Yeah,
everybody else sits
sure.
them on the exam table.
Sure. Dogs don't typically stand up on tables. They aren't on tables. They aren't on counters. They aren't on elevated surfaces. They're on the floor. So again, it's trying to limit the foreignness or the scariness of what's happening, and their natural environment is on the floor.
Mm-hmm.
So if we can work on the floor, it's better for them.
Mm-hmm. Excellent. Okay. Now, you also are an AHA accredited hospital, American Animal Hospital Association. So when you started your practice, did you know right at the beginning you were going to reach that level, or did you? What made you decide to become AHA accredited?
So the AHA accreditation being standards of care and elevated standards of care is what, again, my whole goal with this practice is to provide excellent medical care, and then in a nice environment for the pets and the owners. So yes, this practice was built with AHA certification or accreditation in mind. We were accredited within months of opening our doors, because every accreditation requirement that I could read and knew that we needed to have, it was either built into the hospital or planned to happen as soon as we opened our doors.
Yeah. Now, not every hospital is accredited. Is that correct?
That is correct. Very few. Very small percentage.
Yeah. Only, I think, about 10%,
10 to 12.
10 to 12% in the United States are accredited hospitals. So it is a higher standard of care and a higher standard of practice, just in general,
Correct.
than a lot of practices hold. The other thing that I've noticed about this hospital is that you like to do surgery. You have an additional skill set in surgery. How did you attain that knowledge?
I attained that knowledge from the practice that I worked at when I first came out of veterinary school. Went into that practice as a graduate student, right as I graduated from school, and they needed a surgeon, and they needed one quickly, and so I got thrown into that, and that actually allowed me to see that I enjoyed that aspect of practice and had pretty good skills in that level, in that area of practice. So given that, then I was able to work with the owners of the practice that I worked for. They were wonderful owners to send me to a lot of extra continuing education meetings, a lot of hands-on meetings to acquire skills to then become the primary surgeon at that practice. And loved it. I mean, loved it. I very much enjoyed that aspect of the business.
And so you do surgery here
Yes.
at this practice. What would be a typical surgeries or the types of surgeries that you do here?
Certainly we do our spays, neuters. We do still do some declawing. But then above and beyond that, growth removals. We do a lot of growth removals. We do, I know dogs and cats both swallow things that they shouldn't swallow, so we will take foreign bodies. That's always a fun surgery, especially when it's a treasure hunt to figure out what it is. It's fun to then find out what it is if you can't tell off from the x-ray to begin with. So we do that. Certainly biopsies for cancer type things. Bladder surgeries, we take out a lot of bladder stones. Probably about.
What's the most unusual thing you've ever removed from a dog that it ate?
Most unusual, funnest story. Anyway, probably not totally most unusual. Funnest story was a pug that I removed an entire piggy bank full of coins. And that was a fun one because again, on the X-ray, the whole stomach just looked like metal, and so we didn't know for sure what we were going to get when we get in there. And I got in there and took out, truly, I think about 200 coins out of that dog and saved them for the owner and talked to the owner. And again, the fun part of that story was when I told the owner, she says, "Oh my goodness, we accused our neighbor's child of stealing our son's piggy bank coins because he had been showing the coins because there were a lot of Canadian coins in it." And